Cincinnati Children's was started in 1883, and in 1931, Colonel William Proctor endowed a $2.5 million endowment that started the Cincinnati Children's Research Foundation. Over the next 130 years, Cincinnati Children's has really blossomed into the phenomenal research facility that it is today. There have been several major medical breakthroughs over the years. In the 50s and 60s, Dr. Clark and his colleagues created the first heart-lung machine. After that, Dr. Sabin created the oral polio vaccine. Later on, in the 80s, Dr. Whitsitt created and developed the first cloned surfactant, which has helped babies keep their lungs open, especially premature babies. In the thousands, Drs. Bernstein and Ward created a rotavirus vaccine that's used in hundreds of countries worldwide, and we continue to develop new therapies every day. So the Center for Technology Commercialization has started 8 companies in its history. Of those companies, we've created over 200 jobs for the Cincinnati region. We've seen over 1,000 discoveries disclosed to this office. We've seen over 600 patent applications made. We've seen over 150 patents issued. We've seen over 175 licenses with partner companies. We have 5,000 intellectual property agreements, and all of these are really the discovery that's turned into having an impact on patient care when we get the products back into the market.
Having a facility like this is advantageous for Cincinnati Children's in that it brings a tremendous wealth of experience to the hospital to be able to help investigators bring their groundbreaking research to a clinical trial, and to do that in-house. That is certainly a benefit to our institution. And for the region, it means that Cincinnati Children's is able to attract researchers from around the world that are interested in this type of research and help drive gene therapy forward.
I think the biggest advantage of being a researcher and a clinician or a physician scientist is that you can see what are the unsolved problems. You can see, you can identify problems that we do not have treatments, good treatments for, and then bring it to the laboratory, find a solution for it, and then take it back to the patient.
I think what's most important about what our division is doing is that we're taking the amazing research and the amazing discoveries within Cincinnati Children's and partnering those with companies to bring those back into the clinics that will actually have impact on our patient care. So really what we do here is we translate the discovery into a product that will impact the patient care and change the outcome for kids here in Cincinnati and around the world. Cincinnati is attractive for many reasons. Our entire ecosystem is really fraught with people who are really passionate about Cincinnati and passionate about making this a really good place to do small businesses and to grow those small businesses. So from Cincinnati Children's, where we have, more NIH research than most other places in the country, we're number 3 ranked in NIH research. We have a vast pipeline of potential deal flow, and with our partners like Cincy Tech and REDI Cincinnati, we actually see more and more of those things spun out into companies. Well, we do a lot of things in terms of attracting people to work here. So we, with the opening of our new clinical and translational science building, there will certainly be a number of new recruits in that building. So those are going to be from here in Cincinnati and in Ohio and across, the nation and the world. So, but it's not just about the clinical and translational science building, it's also about thinking about our startup companies. They're going to need, really, really talented people to run those from the CEO level all the way down to technical assistants. So we really do have programs that go out and do recruit. With our partnership with REDI Cincinnati, we hope to do more of that.